Monsieur Thériault pour 2 minutes et demie.
Mr. Thériault for 2.5 minutes. Thank you, Mr. Chair. Dr. Patel, the Alberta Health Minister explained that there are two aspects of addiction: suffering, misery, and death, or treatment. Two paths, rather. Alberta is currently investing heavily to have more beds and more treatment. Safe supply is not possible, and I don't believe that harm reduction is part of their process. In BC, they have done a 180 to mandatory treatment. From mandatory treatment, what do you think of these two models? Yes, it's great to have more spaces for treatment, but without safe supply, and knowing that relapse is part of treatment, perhaps that is leading people to failure.
Correct. So the fundamental paths, I guess, as you've spoken about in Alberta, is suffering and death. Sure, that's cheap. Everybody in the Ministry of Health in every province would like that because it doesn't cost you any money. The treatment plan has a fundamental flaw in it. And that fundamental flaw is that there's only one treatment and it works for everybody. And that there's no recidivism, meaning when you have substance use disorder, you get your treatment and you go home and that's the end of the story. You become a part of society. You contribute like everybody else. And that is a false argument. There's no such thing. How many people do you know that can quit caffeine, cigarettes, alcohol on the first try and never go back? There are some, for sure. There are some people that do it. But the overwhelming majority relapse, and then they go through treatment again. And so if that's your approach, then you're building a foundation that's fundamentally flawed. The second problem with that approach is currently we have trouble staffing acute care hospitals with enough healthcare workers. Where are you going to get people to staff these addiction centers? Is there some magical vending machine that I'm not aware of that has doctors, nurses, social workers, pharmacists that are going to man these addiction centers and follow patients when they fall off the wagon? Not that I can see. So if that's your fundamental approach, you're doomed to fail. And you'll fail miserably.